To focus on the pandemic as the number of cases and hospitalizations continues to drop and the number of vaccinated people does go up. People are starting to return to normal.
So here's a question. What sorts of lessons have we learned from all of this? Beth Esquires, a public health educator from Northern Illinois University, is joining us now. Hello to you.
Hello, glad to be here.
All right, nice to have you. It seems like public health officials got really a crash course on how to handle pandemics. And I'm looking and I'm thinking, as you look back, what do you think was a big lesson, the big takeaway from all this, especially for someone like you?
Biggest takeaway that I learned is it emphasized the importance of just basic public health measures of washing your hands. That is the most effective way to stop the spread of disease. And I hope that it continues to go forward, that people remember to wash their hands when they're, after they're out in the community and, around the house and around work. And it also shows the effectiveness of masks. That did help stop the spread of COVID-19. It did keep the cases down to a point. But what really has shown is the effectiveness of vaccines. Now the numbers are in that decreasing trend that we've been wanting to see since the start of the pandemic, and that shows that vaccines are the most effective way to stop the spread of a disease.
Well, Beth, to that point you're making here, right? Americans, 45% of the whole country is fully vaccinated. What does that mean as you look at the path forward and where we are, 5-6 months from here?
Right. I'd like to still see that increasing trend in vaccinations. I'd like to get to where the majority of the public have gotten the vaccine, because it really is showing the decrease in the rates of the vaccine, of COVID, are showing the effectiveness of the vaccine. And also, research has shown recently that those that are hospitalized with COVID-19 now are in the unvaccinated population. So really, everyone get the vaccine if you're eligible, because that's going to be the best way to get back to normal life again.
Okay, you talked about the effectiveness of mask wearing, and I'm wondering if this is something that you see people or you think people will continue to do even past the pandemic. I see a lot of folks still out on the street. Maybe they have their mask with them, or they think that maybe there are certain areas where they should be wearing them. And I wonder how long you expect that to continue. I know some places may do it long term.
Right. Honestly, if it makes a person feel comfortable, wear a mask if you're out, whatever makes you feel comfortable. I know what I would like to see is if anyone is showing any kind of symptoms of a disease, that they take the initiative and wear the mask if they have to go out and about in the community, because it is effective. We've already seen that even before the pandemic, if you did have symptoms, when you went to the doctor's office, they ask you to wear a mask. And so that would be great if we can take on other cultures, other Asian cultures of when you're feeling under the weather or feeling slightly sick, but you have to go out, wear a mask. So far, again, if you're more comfortable out in the community, wear a mask, because if that makes you feel better about it and you feel more protected.
Beth Squires, public health educator at Northern Illinois University. We appreciate your thoughts tonight. Nice to chat with you. Thank you so much.
Thank you. Appreciate it.
Well, still to come here this afternoon, the Cubs getting